Most toothpaste products on the market today contain some flavorants, peppermints. They contain a chemical called sodium lauryl sulfate, or most of them. That's a saponifier, or something that creates bubbles or suds. Toothpaste also have small abrasive components. Most often this is silica or sand. That helps scrub the teeth clean of debris and stains. And then obviously fluoride. Most toothpaste that you buy over the counter are equipped with a similar quantity of fluoride, and there's two different ways that we deliver fluoride to the teeth in toothpaste, but the distinction is not really important to you. The thing that matters most is that you're buying a toothpaste that's approved by the American Dental Association that has a normal concentration of fluoride in it. Studies have shown repeatedly that proper use of fluoridated toothpaste does not create a systemic exposure to any significant amount of fluoride, but it does help slow down bacteria in the mouth and again create kind of a healthy environment for our teeth. There was a long time, for many years, where parents were cautioned to not use fluoridated toothpaste on their children. We bought special toothpaste for kids that didn't have fluoride, and the presumption was that we didn't add fluoridated toothpaste to the party until kids were effectively able to spit all their toothpaste out. In recent years, standards and recommendations have changed. Now the recommendations from our pediatric dentists and the American Dental Association are to use regular full-strength toothpaste on all kids, any age. You should be brushing a child's teeth as soon as they get them. So at about 6 months, when you see teeth pop, you should be brushing regularly. This means a focused and deliberate brushing both morning and night for all kids. It's important for parents to also understand that children up until about the age of 6 or 7 actually lack the dexterity needed to properly brush areas in the back of the mouth. So it's important, even if you have a really excited 3 or 4 or 5-year-old that wants to brush on their own, make sure that you're either starting or finishing that process for them and focusing on those back teeth kind of around the corners. That's where kids tend to miss. But back to the fluoride applications in toothpaste. The new recommendation is to use regular strength toothpaste on all kids. I like to tell parents that we split the amount of toothpaste into one of 3 categories. For a really small child, basically the ages of 6 months to about 2 years old, we like to apply something called a smear, which is a very, very small amount. You're going to kind of squeeze your tube of toothpaste just enough to see a little crest of toothpaste pop out of the tube, and you're going to scrape that across the tips of the bristles. You should see no mound or globs of toothpaste, but if you have a blue or a pink toothpaste, you should see just a little bit of residue on the tips of the bristles. That is plenty of toothpaste to create a positive effect in the mouth with the fluoride and the cleaning capacity, but not enough, even if swallowed in whole every day, to create a systemic exposure to a significant amount of fluoride. The next amount is really, really easy to visualize, and that's kind of a small grain of rice. Kids about between 2 and 3 to the ages of about 4, 5, or 6, depending on your child's development, we want a grain of rice size toothpaste. This is a kid that's actively involved in their brushing. They have all of their baby teeth. That would be 20 baby teeth. They maybe spit a little, but probably not every time. And this is the perfect amount to make sure that we're cleaning effectively all areas of the mouth, exposing the teeth to a little bit of fluoride, and getting clean without the risk of quantities of fluoride that can be dangerous. As we get into that 5, 6-year-old range, when kids start to be able to spit effectively while they're brushing their teeth, we switch to a pea-size amount. And so again, the 3 sizes that we want to consider are for babies. 6 months to 2 years is a smear. Between 2 and about 4 or 5 or so, it's about a grain of rice-sized toothpaste, and then a pea size as we get into an age that we're a little more comfortable brushing on our own and spitting. And if we're following these types of directions, we're creating a pathway to dental health, exposing them to a great amount of fluoride and cleaning capacity with the toothpaste, and also doing it in a safe and effective way.